to be honest, I never bought a single textbook ever in my dental school career.
I'm losing sleep, light a smoke so I can breathe.
Hey guys, welcome back. This is Dr. Wendy Zhu and I'm back with another video, this time about my particular dental school experiences. I literally just filmed a questionnaire about top 7 tips of getting into dental school. I literally just filmed and changed my shirt so it looked like it was a different time that I filmed. But today let's talk about some questions about the school that I went to and some of the experiences that I'm reflecting on. To be honest, I'm just stealing this questionnaire from the Student Doctor Network forum. But if you have any questions again about applying, I know your mind's probably focused on applying at this moment, but leave me a comment. I'll either hit you back up or send out another video about another set of common questions. Alright, let's go ahead and get started on name of your dental school. I graduated last year, class of 2016, from the University of Detroit Mercy. What was your examinations schedule, like block schedule or several every week? I think there were exam seasons, so we went through phases of a lot of classes, a lot of tests, quizzes here and there, but exams were usually around the same time. And we also didn't have any time off, so class, clinic, or sim lab, they continued to go when you had exams, and they just scheduled exams like at the ass crack of dawn, 7 in the morning, before your clinic or before your labs would start, unfortunately. What was the hardest class and why? This is going to be a hard question to answer. It's different for every situation, but I would say the hardest class, didactic-wise, was probably physiology, and it's not even going to be because of the content itself. I would probably just say lack of skill in the teaching aspect, if that makes sense. So it made the tests really hard too because they were just kind of obscure, hard to answer. But I guess a lot of the harder classes people found were physiology, biochemistry, anatomy, things like that. What was the easiest class? I would say the easier classes were always dental focused, so things like dental anatomy were pretty easy just because they were, really straightforward things to look for, like what does this shape look like, what is this cusp called, and so forth. So very easy to study for as long as you put in the work. Our class notes based primarily in textbooks or based off lecture PowerPoints made by professors. I would say 80% through PowerPoint. Sometimes here and there there'd be questions from textbook, but and I guess I would consider textbooks as supplemental, and to be honest, I never bought a single textbook ever in my dental school career. So there are some professors, I'll tell you though, that'll throw in a few questions here and there that you would only find from the textbook, and they wouldn't even tell you that you had to read the textbook, and that was their way of kind of tricking you or rewarding those who actually did do their readings, which were far and few. Our traditional paper textbook use or the electronic. I didn't buy any textbooks. I was too cheap from the tuition was astronomical as it was, so I downloaded a PDF if I could find it, but sometimes I just didn't even bother reading a textbook at all. What is the grading system? Pass, fail, honors, letter grades, percentages. Back in Canada, I was always used to percentages, but when I moved to the States, I found most school systems do go by letter grading. Well, I think you had a percentage score on things like tests and exams, but your final grade was always a letter grade with either plus or minus. Are your classmates generally gunners and try to sabotage each other, or everyone helps everybody out? Within my close group of friends, all our Canadians, we always shared our notes. We shared old tests that we could find. We shared everything. We never really held out. But I know there are definitely some gunners who would either rat you out or, not share anything. So I'm assuming that's the same everywhere. Is there a note-taking service for lecture available? Nope, gotta do it on your own. Class attendance is mandatory. It would be split between yes, mandatory, and you had to sign in, otherwise they dock marks if you weren't there. and some people would sign other friends' names in. Of course, happens everywhere. And then some classes generally don't care, but I believe the profs were deep down pretty hurt and crying inside if you didn't show up to their 7:30 class. In general, are teachers approachable for questions, or are they very busy and unreachable? I would say most do answer emails, and if you stop by after class, they kind of have no choice but to answer you. But now that I think back, they were pretty busy, and none of them really loved teaching in particular. It was kind of their side thing that they had to do. So they wouldn't love it if you answered questions. Some do, some like love teaching and want you to ask questions. But yeah, ask questions in class. There are people who always asked questions in class repeatedly. So it helps out everyone kind of. Sometimes it's annoying, but ask questions if you need to. What is the dropout rate? Pretty low, I'd say. Maybe about few that drop out, a few that do fall to a class behind, but very few, and their spots do get filled. Are there any resources to help students who are struggling? I do believe we implemented like a tutor system, but there are other classmates of yours that would be providing the tutor services. I never used them. I just kind of studied on my own. What is the % first-time board pass rate? I believe most people do pass boards. Most of my friends did. I know there's people definitely who don't pass the first time, but I guess they weren't anyone that I knew personally, or maybe they didn't tell me when they didn't pass. I did pass everything board related on first try, but it is going to depend on NBDE, the written or the clinical, because there were a lot of people who didn't pass the clinical boards, sometimes just because their patient didn't show, stupid things like that, or their patient didn't get approved. Those were the stressful and annoying aspects of passing dental school. Does the school offer classes, review sessions to prepare for part 1? I believe they did. This was 5 years ago now, so my mind is blanking. But I do think they did prepare you. They had like a mock board online that you had to pass before you were, cleared to take your real boards. So they did do a little bit, the school itself. Do you get block off time for boards to study? No, hell no. You studied everything on your own, and you were expected to keep up with your class and clinics. Do most people study in the university library, or does the place clear out right after school? I never studied in the library unless I had some time in between class or clinic. I didn't really like the library. I don't like libraries in general, so sometimes I'd study in the lounge if I were at school. But being in the ghetto of Detroit, quite literally, I either just went home to study or would go out of Detroit and study at a Starbucks or Panera or something. And I think most people did do that. Are patients readily available to fulfill clinical requirements, or do you have a lot to work to get them in? I would say it would be easy to do things like perio or gum gingival requirements were easy. Things like crown and bridge were harder to come by, and you would just have to be really buddies with people that you could trade requirements with. I'll give you a denture to do if you can get me my last crown requirement, things like that. I don't think anyone in the end had a lot of trouble. After we were trading and really digging to look for these patients, everyone did end up finding their requirements for clinic. Is it a hassle to get a chair once you get your patients in? No, we always had chairs available. I don't think that was a problem. What were your clinical requirements, and were they reasonably attainable? I think we had 5 or 6 crowns that we had to do, 5 endo canals, 2 denture sets, 2 partial sets, and I don't think there was anything in particular for fillings, no concrete number, just that we did have tons and tons of competencies that we had to pass and get through. So that was more difficult than actually fulfilling all the requirements. What types of opportunities do students have to explore different specialties? We had a specialty clinic for all aspects. I think pedo, we had our own separate clinic, oral surgery, we had all those going on. So everyone was rotating through them, but outside of that, there wasn't too much extracurricular that we really got into. Is there sufficient preparation for practice management? What career placement opportunities do they offer? We had a class that was based on practice management, but I don't think it helped anybody, and none of us opened our own practice out of school. Very few people do that, so by the time I am even ready to open my practice, I don't remember anything that I learned in that class. They didn't give you any career placement opportunities, but we did have a lot of lunch and learns, people coming in as recruiters to get students interested in their corporations. So that they did prepare for us, but it's mostly the corporations wanting to get their name out. What is the dress code? Scrubs, and for what years? All 4 years, scrubs were primarily the dress code. I think if you only had class or didactics in first 2 years, you could do business casual, but I don't think they let you wear non-scrubs in the clinic. I think it was always scrubs, and they're just easier anyway. Is there much camaraderie between students in the same class? Do they associate with each other outside of school? Yeah, of course. I mean, don't be a loner in dental school. Like, get to know people. Don't be someone that hoards all the notes and doesn't share. Like, be engaging. What student organizations are most active? Definitely the ones that get their names out and organize a lot of activities. I know ASDA, the American Student Dental Association, in each chapter has a lot of activities. What are your opinions in the location of the dental school? Is finding housing an issue? Is safety an issue? I can guarantee you there is probably not one other dental school that has a slummier location than the one I went to. But I did really like Detroit, and I think it's getting a lot better. It's really cultural and a lot of things to do. I liked it. I lived right in downtown Detroit. It was an easy and fast commute to school, which was preferable in my case, so I didn't think the location was too big of an issue, but safety was kind of a big deal because almost everybody, or a lot of people, had their cars broken into, whether it be on campus or around campus. I did, I think twice. Several students had their cars broken into several times throughout the school years. But try your best to be safe. Some things you just can't be in control of. What do you not like about your dental school? It wasn't very well organized with my class in particular because we had expanded. It's all about the money, gotta expand your class size. So a lot of things did not work. Trying to squeeze us all into the clinic at the same time. But that's pretty much it. A lot of faculty were hard to work with. I mean, most weren't. Most were pretty well to get along with, but I think the stress of dental school, when I remember, was pretty monumental, and I'm just really glad to be done. It's much better to be in the working force now. Any last words or advice? Try your best to have fun. Oh, okay, that's like so cliche, but I can think back of all of the good times and remember those a lot more than the struggles and the sleepless, horrendous, stressful nights. So get out there, make friends, do things that you enjoy, and yeah, because it's just 4 years. It'll be over before you know it. We are all done for our video today. Again, let me know if you have any other specific questions that I had not covered yet, and I will check back with you guys later. Maybe another dental related video, or maybe something absolutely non-related. Don't really know yet. Alright, take care guys.
It's just a day. It's hard to find the love through every shade of